It is possible to have a positive pregnancy test result at about 5 to 6 weeks of pregnancy, and then when you're given an appointment to come for your ultrasound scan to confirm the pregnancy, you actually see a sac and the pregnancy is confirmed, but the embryo does not develop. This is called blighted ovum or anembryonic pregnancy. If you're new to my channel, I'm Dr. Amarachi Ijeoma. I'm a fertility physician and my channel focuses on everything women's health and infertility. So if this is something you are interested in or you think you'll be interested in, please subscribe to my channel, like this video, and if you have questions, drop it in the comment section below. A blighted ovum is a fertilized egg that actually attaches to the uterine wall. It implants on the uterine wall but does not develop into an embryo. An embryo is an unborn baby, usually in the early stage of its development, before the 11th week of pregnancy. That's actually before the 9th week post-fertilization. I explained it in my previous video, but again, I'm going to explain it. When you miss your period, for example, you see your period every month, but you're trying to get pregnant, and then you miss your period. When you do a pregnancy test and it's positive, that is 2 weeks post-fertilization, but it is 4 weeks pregnancy, because in medicine, again, we calculate from your last menstrual period. So an embryo is in its early stage of development, is an unborn baby before 11 weeks of pregnancy, but before 9 weeks post-fertilization. So after the 9th week post-fertilization, it's now called a fetus. Thank you very much. You're welcome. So now you know the difference between an embryo and a fetus, but back to blighted ovum. So what really happens in blighted ovum is that the embryo does not develop at all, or stops developing very early, so it now leaves the sac empty. When you come for the confirmation scan, what we look out for is a sac, an empty sac, to confirm that you are pregnant. So by your next visit, which is usually 2 weeks after, we want to check for the fetal pole. We want to check that the fetus, the embryo, is growing. So when we don't see any embryo growing, then it means that it is a blighted ovum. It means that the embryo did not develop at all. Blighted ovum actually occurs early in pregnancy as well, just like the chemical pregnancy. If you've not watched my video on chemical pregnancy, I'm going to link it somewhere on the screen. You can click on the video if you want to know more on chemical pregnancy. So sometimes in blighted ovum, you might not even know that you were pregnant. What could cause blighted ovum? The cause is usually unknown, but it may be due to chromosomal abnormality of the fetus, which is actually like genetic abnormality of the fetus. If the fetus doesn't have complete chromosomes, if the fetus doesn't have the normal structure of the chromosomes, or it has like abnormal DNA in the chromosomes, it could cause blighted ovum. If the fertilized egg has abnormal chromosomes, if it doesn't have complete chromosomes, if it doesn't have the normal structure of chromosomes or abnormal DNA in the chromosomes, it could cause blighted ovum. In blighted ovum, you could have morning sickness, nausea, vomiting, breast tenderness, that's soreness of the breast. But when the embryo stops developing, the hormone levels, the pregnancy hormone that causes all of these symptoms will drop, and then it will make these pregnancy symptoms to start subsiding. It will start reducing till you can't feel it anymore. And then you might notice abdominal cramping, small light spotting, pinkish vaginal discharge, or even bleeding. Blighted ovum eventually leads to miscarriage. Your doctor might decide to wait it out and allow it to, get reabsorbed into the body naturally or come out naturally, or they might give you medications that will trigger the miscarriage. Just like chemical pregnancies, blighted ovum should not affect your pregnancy. Many women that have had blighted ovums have gone on to have multiple pregnancies, have gone on to have healthy pregnancies, healthy babies. So the difference between chemical pregnancy and blighted ovum is that in chemical pregnancy, it's not confirmed with a scan. Like when you do the first scan that is supposed to confirm the pregnancy, you don't see anything on the scan. But in blighted ovum, you actually confirm the pregnancy with a scan. In my last video, I talked about ways to deal with grief associated with miscarriages, all types of miscarriages, whether it's chemical pregnancies, blighted ovum, first trimester miscarriage, late miscarriage. I talked about how to deal with the grief from miscarriage. So you can actually go back to my video and watch it if that's something you'll be interested in. If you found today's video informative and you want more content like this, please subscribe to my channel, like this video, and see you in my next video.